Have you ever explained asthma to a patient in 3 different ways and feel like they're just not getting it? Well then, this episode is for you. Hi guys, welcome back to RTs Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everyone. Welcome to anyone new. And I know I haven't dropped a few episodes. I haven't dropped some episodes in a few weeks, but your girl took a little vacation. We're back, refreshed, renewed, and we are here. In today's episode, I'm giving you 4 patient-friendly asthma self-management videos that you can confidently use in any setting, a hospital setting, clinic setting, or community setting. These are short videos, easy to follow, patient-friendly videos that reinforce asthma self-management. And I have an additional bonus webinar for us educators. The reason why videos matter in asthma education is because everybody learns differently, right? So these are tools that we can use to reinforce asthma self-management skills. So this can help, these tools can be useful while sitting, waiting for an appointment. It could be useful for those that are visual learners, for those that have maybe English as a second language, and it also helps when patients can use reinforcement at home. And so they can watch it in their own time. So videos are my go-to when I feel like there is a huge health literacy gap. Asthma education is repetitive. So oftentimes it takes time for folks to really understand or grasp even the most basic of Asthma 101. Okay, so the first video that I'm showing is one from the Asthma and Allergy Foundation of America. I like this video because it's a 3-minute or less video series, and it covers the asthma basics. So everything from what is asthma to what the triggers are and everything following that. But they are relatively short and very easy to follow.
Chronic disease that causes your airways to become inflamed, making it hard to breathe. Your airways are the paths that air takes to get oxygen to the body. When your airways are inflamed, they become red, swollen, and make extra mucus. This can make it hard to breathe.
The next video that I'm recommending is this video called How Does Asthma Work? It's another asthma basic video. I actually feel like this video is very visually engaging for family members, for those with asthma. It's a very short video. It's an animated 5-minute video, and it's using medical terminology, but it's relatively simple to follow. So you're able to get the best of both worlds.
Get asthma, and how can this disease be deadly? Asthma affects the respiratory system, particularly the smaller airways, such as the bronchi and bronchioles. These airways have an inner lining called the mucosa that's surrounded by a layer of smooth muscle. In people with asthma, the airways are chronically inflamed.
The next video is from the National Heart, Lung, and Blood Institute. It's another short video, but this one is specific on learning how to use an asthma action plan.
One way that you can keep your asthma under control is to partner with your healthcare provider to create an asthma action plan. An asthma action plan is a written, customized guide to help you take your medicines properly, avoid irritants that can cause an attack, and treat other conditions that can interfere with asthma control.
The next videos is very specific to inhalers and inhaler technique. So I really like this one. It's from the Allergy and Asthma Network. It is a series of videos. So they're called How to Use Inhalers. It is called How to Use Inhalers. It is a video series. They are very short, very engaging because it is demonstrating exactly how to use each inhaler. They go over the inhaler. They go over with the inhaler, with the spacer and a DPI. And I really think that these videos are useful and once again, very easy to follow.
Take the cap off of your inhaler. Make sure your inhaler is clean. Shake your inhaler at least 3 to 4 times to mix the medicine. Sit up straight or stand if possible. Hold your inhaler away from your face and then breathe out all the way. It is important not to exhale into your inhaler.
Oh, and I forgot to mention that most of the videos, especially the Asthma 101 videos, they do mention identifying triggers and how to prevent an asthma flare-up and, just how to manage your asthma overall, if I didn't mention that already. So all of those things are being covered. So my advice is to check out each one of these videos. I'm going to put them in the description and really come up with a toolkit for your patients, especially for those that are looking at you like you have 3 heads every time you explain asthma, or if they're not understanding the difference between a rescue inhaler and a control inhaler. Why do they need all these different types of medications? Or if they just need a little extra, right? Some of us, we just need extra help. All right, guys. And I have something for you guys as the asthma educator. I have a bonus webinar to also help you guys. In this webinar, it goes over inhaler techniques. It goes over the common errors that we see with patients and how to work with them, engage them in correcting the errors. All right. So really about having shared decision making and empowering them. So that's why I really enjoyed this webinar. I'm going to put this one in the description below. So that's kind of like your starter point for those of us that provide asthma education. Okay, because you know me, I love sharing the tea, giving you guys a toolkit, a toolkit of what can help you get patients to a point of asthma control. So here are some practical tips on how you could use the videos. You can send it to the patient before the clinic appointment. Right? You can send it ahead of time of a home environmental assessment. If you have that type of program, you can have them watch it while they are waiting to see the healthcare team. You can have it in the waiting area. So and hey, listen, if you have the budget and you have an asthma program, you can consider creating your own video, and we've done it for our program. So it's just something to consider if you have a little extra wiggle room in the budget, because videos are helpful and they do matter in regards to asthma education. And you can even do a teach back. You can even do after the videos, you can ask the patient, hey, how did you feel after watching the video? Can you explain to me in your own words, what is asthma? Just to kind of see what did they grasp. Yeah, guys, so that's all I have here for today. Just know that asthma education is not really just about talking to people, talking to patients. It's about giving them the tools that they need to feel confident in their own asthma self-management. So if you find this video useful, Please share it with another asthma educator. Let me know if I missed a really good video. I will give you full disclosure that I did not, this video is not sponsored. No one told me to share any specific video. There are so many different videos out there. These are just ones that I connected with the most, and I felt like they were short and easy to grasp. But there are so many videos out there, and you can consider this as a starting point for you. All right, guys, thank you so much for being here with me. Know that we are here every Wednesday on most of your favorite podcast streaming platforms, and we are on YouTube on Thursdays, except for when I'm on vacation. All right, guys, so I hope to see you soon. Bye.